So in terms of scar care, we have some general recommendations and rules of thumb, though every case may be a little bit different. Typically, we like Bacitracin ointment while the sutures are still in. And as soon as we remove the stitches, we usually like Bacitracin for another day or two once they've come out. Following that, there's several different things we tend to recommend. Vitamin E cream or a green tea cream. And lately we've been recommending a grapeseed oil because this has a high concentration of vitamin E as well as some other antioxidants. So keeping the scar lubricated and nourished with grapeseed oil post-operatively at least once or twice a day works really, really well for several weeks and months. And we often have you alternate. So grapeseed oil perhaps at night, then in the morning a vitamin E or green tea cream for a day or two, and then switching to a silicone type based cream like Mederma. Depending on where the incision is, you can get a silicone based scar strip and actually place that strip on the scar, leave it for a day or two, remove it, and then cycle back with grapeseed oil, vitamin E, green tea for 2 more days. Then the Mederma or scar care strip on for another 2 days, and alternating back and forth. It's normal for every scar to be more red and obvious for a period of time. Everybody's a little bit different, and it has to do with skin color, genetics, pigment, those types of things. But in every situation, a scar, whether inside the mouth, on the face, on parts of the body, tends to be more obvious for a period of time, and then undergoes a period of maturation where it will soften, become more skin colored and lighten. At times, a scar can become raised or elevated, and we may wish to do some injections, steroid injections or 5-FU injections to help this calm and to be a little bit less itchy. At times, too, we may consider PRP injections to help lessen the scar, as well as some laser to help blend some of the textural abnormalities. But we usually want to give a scar a period of time to naturally heal or fade on its own before we contemplate some of those injections or interventions. At times as well, we may see a traumatic scar, and we know that ultimately that will need to be revised, meaning that we will surgically excise or remove the scar and place a new set of fine sutures to help alleviate and mitigate the issues from that scar. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.